talk to you about the progression of substance use. When people start using substance uses, they may ask themselves, am I using this for pain or pleasure? Are my consequences negative or positive? Or can I stop anytime? While diagnosis is just the first step in the treatment of a substance use disorder, it is almost impossible to develop an effective treatment plan without establishing if the substance use is problematic or recreational. Progression of substance use is viewed as either an increase in consumption or an increase in problems. When we look at the progression of substance use, we usually look at 3 stages. Here are the progression stages. Stage 1 is experimental use, Stage 2 is recreational use, and Stage 3 is problematic use. Stage 1, the experimental use, usually happens between the preteen, adolescent, and teenage years. Not all people who start in the experimental use will progress to the recreational use. Recreational use is Stage 2. Not all people who go to the recreational use will go into the problematic use. But recreational use, for example, would be about 90% of our population can consume alcoholic beverages without having significant issues. And Stage 3 is our problematic use. At this use, the problematic we'll break it down into substance abuse and substance dependence. Now, I will break it down for you guys again. This chart will show the stages, the dynamic, and the control levels. So when you're in the experimental stage, your dynamic is mostly curiosity, and you are still in full control. When we go to our recreational stage, the dynamic is fun, and your control level is still your choice. And when we go to the abuse, which is our problematic stage broken into 2, when we go to our abuse stage, that person is most likely in denial, and their control is limited. In the dependent stage, your dynamic is now an addiction and impaired. Your control is impaired. Both of these charts are from the Wiley Concise Guides to Mental Health. Now, our experimental use, an example of experimental stage would be an adolescent experimenting with drugs, doing some here or there, but they are in full control and can stop whenever they please. An example of our recreational use might be a person going out and drinking in social environments to enhance their social situations. For example, a young girl in her mid-20s might go out at a bar and drink with her friends, but she doesn't have the urge when she goes home to continue drinking or to drink on a day-to-day basis. When we go into the abuse part, this person is going to start experiencing consequences, occasionally, that correlate with their substance abuse. This person will most likely hit denial, and so they might try and start to control their, might start to test themselves and maybe try and stop or moderate their use just to see if they can. There's a kind of a small window right here to get help before they go straight into the dependent stage. Now, when you fall into the dependent stage, this is most of the time, whenever a person hits the dependent stage, they will tell you that this is when their drug of choice or their substance use was no longer fun for them. At this point, and at this stage, their bodies became chemically dependent on their substance uses. So they no longer had the choice to stop. Without that substance use, their body would experience serious withdrawals. Substance use disorders and using substances are a very slippery slope. My advice is don't do it. Get out while you can. Don't go down the dark path of destruction that so many cannot get out of. Thank you.